Hello, my name is Eoghan Hayden and I am the Chief Clinical Engineer at the National Maternity Hospital in Dublin and the current chairperson of the Biomedical and Clinical Engineering Association of Ireland. And I would like to present to you today on the Equals Initiative. The Equals Initiative team comprises of a diverse working group of people with clinical, technical and logistical backgrounds. Both Carol Bergen and I are clinical engineers working in hospitals in Dublin, Ireland. David Weekleem is the Global Health Programme Director in the Health Service Executive of Ireland, otherwise known as the HSE. Professor Frank Murray is a founding member of the Equals Initiative and the ex-president of the Royal College of Physicians of Ireland, the RCPI. Professor Dermot O'Donovan is a professor in global health at Queen's University in Belfast. Both Tamsha Tracy and Danielle Prenderville work in the International Medical Training Department at the RCPI, and Brendan Chauvelin is a procurement manager in the HSE. In 2013, a colleague of Professor Murray working in the Monzi Missionary Hospital in Zambia rang and asked him to send over a functioning ultrasound machine as theirs had broken down and they had no way to repair or replace it. This phone call started a conversation among a few like-minded individuals who asked themselves, can we do more? It became apparent that there was no official mechanism in place in Ireland which donated reusable medical equipment to less developed countries, and so the Equals Initiative was established. It is a collaboration between the RCPI and the HSE to create a sustainable equipment donation pathway between Ireland and partner developing countries. Until now, the programme has focused on the donation of reusable, good quality equipment to Zambia, building on an existing relationship. The Equals Initiative focuses its efforts on two main areas: the donation of medical devices and the clinical training and development. Carol Bergen and I lead the medical devices function of Equals, which includes the sourcing and donating of good quality, reusable equipment, which becomes freely available from Irish hospitals to teaching hospitals in Zambia, and supporting the training of local biomedical engineers. We have done this by building up a network of partners throughout Ireland, both in the healthcare and medtech sectors. We conservatively estimate that approximately €140 million is spent on replacement medical equipment in Ireland per annum, of which we have only been able to receive the donations of a small percentage. Thus far, the Equals Initiative has funded 2x40-foot containers of equipment per annum to Zambia. We were also able to host a Zambian biomedical workshop in March last year, which had biomedical representatives from each of the 10 provinces in Zambia. This was a very useful networking opportunity for both Equals and the engineers, and is something we hope to continue to run yearly. Since the establishment of Equals, we have managed to increase our shipping capacity from 1 container per annum to 2 containers. Equipment sent is needs-based and not supply-driven. We have a memorandum of understanding with the Zambian Ministry of Health, who informs Equals of their specific requirements, at which point we utilise our extensive network and attempt to source good quality, reusable equipment in Ireland. Containers are shipped directly to the Zambian Ministry of Health central stores in Lusaka, from where it is collected by the requesting hospital. Where possible, and if necessary, a member of Equals will travel to Lusaka to meet with the local biomedical engineer to provide on-the-ground training and education in the use of the equipment. Although the Northern Technical College in Zambia runs a successful diploma in biomedical engineering with a number of graduates per annum, we found it useful to run a biomedical engineering conference to reinforce that learning with local biomedical engineers on various topics, including medical device management, preventative maintenance scheduling, maintenance programs, project management, and risk assessments. It was also useful to hear directly from the engineers in terms of their workshop needs, and has enabled us to focus on the donation of tools, test equipment, and other essential biomedical engineering accessories for the effective operation of a biomedical department. It also assisted us in developing a shared learning environment for local biomedical engineers for equipment manuals, training, and education material. The landscape has changed somewhat in the context of the COVID-19 pandemic. Recently, Ireland has donated emergency supplies, particularly of unneeded personal protective equipment, to countries such as India and Nepal, arranging shipments in a short time frame in response to the needs of these countries during a time of high incidence of COVID-19. This provides an opportunity for Equals to build on the success it has seen in Zambia and to expand its remit primarily through increasing the capacity of the donation arm of the programme. The team aimed to increase the reusable medical equipment available for donation to developing countries from approximately 10 to 30% over the next 3 to 5 years. In addition, new partnerships will be formed with a number of other developing countries whilst maintaining links with Zambia. Our ultimate vision for the initiative is an end-to-end equipment donation program whereby eventually all reusable equipment that is suitable for donation is available to be sent to developing countries. In addition to this, we envisage that all new equipment and supplies that are not going to be used would be available for donation to developing countries, whilst maintaining that only appropriate equipment should be donated. It is also essential to ensure that the donated equipment will be maintained by people with the skills to use it in the recipient country, and that the donation should meet the standards of best practice for equipment donation, in addition to environmental and waste management standards. Thank you very much for listening. I hope you enjoyed the rest of the conference.